Hi, my name is Joe Whiteside. I'm the clinical director here at Anatomical Concepts, and the purpose of today's video is to go over the proper donning and doffing or application of our new K-ROM and Pentagon posterior upright knee orthoses. I'm going to have you take a look at the actual orthoses itself. We have 3 straps on the calf section, 3 straps on the thigh section. I've went ahead and loosened the straps, all except for the most lower strap on the thigh section. But you want to loosen all the straps, and it's a good idea to put the hook Velcro back onto the pile. It keeps the straps from sticking to each other and being problematic. Then you want to go ahead and open up the thigh cuff completely and the calf cuff completely. Again, it's a posterior upright design, real simple, unique design that doesn't require any contouring. When you place it on the patient's extremity, gently raise the patient's limb up, position that posterior upright so that it's at midline on the posterior or the back of the patient's extremity. Huge advantage with that is it's not necessary to do any contouring of any uprights to follow the anatomy on your typical double upright or medial and lateral upright designs that are on the market today. So it's real simple, quick fit, stays away from all the bony areas on the leg. When you start to position it, again, line it up posteriorly so that the upright's at midline in relationship to the leg. You also need to make sure that the relationship of the patient's knee, where it bends, and the bending point, which is indicated by this nickel-plated nut here, adjustment nut. You want to make sure those are lined up and congruent with each other so that you have the center of the patient's knee lined up with the center of the actual bending point of the posterior upright on the Pentagon or K-ROM knee orthosis. Next, what you want to do is go ahead and fasten the lining system on the calf section. And at this point, we've already pre-trimmed this, but you can actually trim off whatever additional length you may not want. We trimmed this again already for this presentation, so you can fit that appropriately to your patient. I typically recommend that you leave a couple of extra inches to accommodate for any volume changes for the specific patient populations that you may be using this on. Tuck that in nicely and securely. Go ahead and fasten the hook part of the Velcro to the lining on the tibial section, and then you want to proceed up to the femoral or thigh section. It's the same procedure up here. Wrap it around. We've pre-trimmed this. You could actually probably trim off even a little bit more, but I'm going to go ahead and leave it just as a reference point, and then go ahead and secure up the Velcro fastener there. At this point, we pre-trimmed it around the actual knee. Again, you can just take your scissors, bandage scissors, cast scissors, and go ahead and trim the actual area around both proximal or above the knee and below the knee, whatever is appropriate for that patient, or you can just leave it fully covered if you like. Once it's trimmed, there's plastic panels on the medial and lateral borders of the extremity, or the inside and outside of the extremity. These can be repositioned or trimmed accordingly to the patient's anatomy as well, if needed. At this point, you want to proceed with fastening the straps. And one nice feature about our Pentagon and K-ROM strapping system is that we have a quick removable tab here on the end of the strap that you can actually trim off any extra strap that you may not need real quick in the field. Go ahead and fasten that tab back on. It's very secure and it won't come away from the actual Velcro itself. Go ahead and cut them to appropriate length. Start with the strap on the proximal calf first, the distal calf or the bottom of the calf second, and the middle of the calf third. Once you have the calf section completely secured, as you can see here, then you go ahead and proceed up to the thigh section and just work your way starting with the distal or the bottom thigh strap first, fastening that up. And again, all these straps have been pre-trimmed for this video. The middle strap, snugging that up. Again, trying to keep the lining system as smooth as possible. Oops, connected it to the strap. And then the last strap, most proximal, or at the top of the thigh, and go ahead and secure that up. And there you can see a nice fitting, the orientation of the actual knee on the patient, the alignment of the anatomical axis with the mechanical or the hinge point indicated by the silver nut on the extremity. I'm going to go ahead at this point and bend the extremity too. What's unique about the design being posterior upright is the cuffs actually shorten as you flex the patient's leg, and you can see those cuffs shortening up from 0 being a fully straight position to 110 degrees mechanically in flexion. and then go ahead as you extend the leg out. You can see how those cuffs lengthen on the upright, and what that does is minimize any shear force that would typically be a problem with a posterior upright design. Again, shortening, as you can see here at the knee there, you can see those cuffs getting closer to the knee center or the joint itself, and then as it lengthens out, as you fully extend the extremity. We have separate videos in regular video form and or digital form that actually show the range of motion and the actual locking mechanisms that are inherent and specific to either the K-ROM or the Pentagon design. But that's a quick overview of the appropriate donning and doffing and application of the actual Pentagon and K-ROM single posterior upright design that we have now. Thank you.
Since this device requires some custom fitting, we recommend it be fitted first by a medical professional. Place the Pentagon so that the posterior aluminum upright is centered against the back of your patient's leg, and that the chrome nut for the range of motion setting is placed in line with the center of the knee when viewing it from the side. Once properly positioned, secure the calf cuff and thigh cuff Velcro enclosures. Trim away any excess material on the thigh and tibial liner as needed. At this point, the femoral and tibial plastic stabilizers, both the medial and lateral, can be repositioned and trimmed to match the dimensions of the patient's leg if necessary. Be sure to smooth all sharp edges after trimming. Next, begin fastening the individual straps. Start with the strap at the top of the calf section and proceed from high to low. Then, fasten the thigh straps, starting with the lowest and working your way up to the top strap. In some cases, the straps may need to be trimmed. Pull away the long inside end of the Velcro tab, then remove the short outside end of the tab. Use scissors to cut the strap to the desired length. Reattach the long end of the Velcro tab on the inside portion of the strap, and finish attaching the Velcro tab by folding the short end over the end of the strap. Then reattach the hook side of the Velcro to the outside of the strap.